Welcome to Sex Education Repo, your go-to resource for clear and honest information about sexual health. Today, we're diving into a topic that many people consider for permanent birth control: sterilization. Specifically, we're comparing vasectomy for men and tubal ligation for women. You might be surprised to learn that although one procedure is significantly simpler, safer, and quicker, it's performed far less often. Let's break down the medical facts to understand why this is the case and explore what each procedure truly entails. First, let's look at the procedures themselves. A vasectomy is a minor surgical procedure designed to block sperm from reaching the semen. The doctor makes a small incision or puncture in the scrotum to access the vas deferens, which are the tubes that carry sperm from the testicles. These tubes are then cut, tied, or sealed. The entire process is relatively straightforward and typically performed in a doctor's office or clinic under local anesthesia, meaning the patient is awake but the area is numbed. Now, let's contrast that with tubal ligation, often referred to as getting your tubes tied. This is a more invasive surgical procedure for women. It involves blocking or cutting the fallopian tubes to prevent eggs from traveling from the ovaries to the uterus. Because the fallopian tubes are located inside the abdominal cavity, the surgeon needs to access them through incisions in the abdomen. This usually requires general anesthesia, meaning the patient is completely unconscious, and it is performed in a hospital or surgical center. The complexity is inherently higher. Next, let's talk about procedure time, a factor that highlights a major difference between the two. A vasectomy is remarkably quick. The procedure itself usually takes only about 15 to 30 minutes from start to finish. Patients can typically go home the same day, often shortly after the procedure is completed. It's often considered an outpatient procedure that doesn't require a significant time commitment. Tubal ligation, on the other hand, takes longer. The surgical part of the procedure can last anywhere from 30 minutes to an hour, but this doesn't account for the preoperative preparation and postoperative recovery time in the hospital. Given that it's performed under general anesthesia, patients need to be monitored for several hours afterward as the anesthesia wears off. In some cases, an overnight hospital stay might be necessary, depending on the specific technique used and the individual's recovery. Recovery is another critical area where these two procedures differ dramatically. For a vasectomy, the recovery period is generally short and manageable. Most men experience some mild discomfort, swelling, or bruising for a few days. Pain is usually managed with over-the-counter pain relievers, and applying ice packs can help reduce swelling. Most men can return to a desk job or light activities within 2 to 3 days and can resume more strenuous activities, including exercise, within about a week. The recovery from tubal ligation is significantly more involved. Since it's an abdominal surgery, the recovery period is longer and typically more uncomfortable. Patients often experience abdominal pain, bloating, and fatigue for several days to a week. Returning to normal activities takes more time. Light activities might be possible after a few days, but strenuous exercise and heavy lifting are usually off limits for several weeks to ensure proper healing of the internal and external incisions. It's a much more disruptive process to one's daily life. Now, let's get to one of the most important questions: how effective are they? Both vasectomy and tubal ligation are considered highly effective forms of permanent birth control, but there are slight differences in their failure rates. A vasectomy is one of the most effective methods of contraception available. The failure rate is extremely low, estimated to be around 1 in 2,000 after the procedure is confirmed to be successful. It's important to note that a vasectomy isn't effective immediately. Sperm can remain in the vas deferens beyond the point of blockage for several weeks or months. A follow-up semen analysis is required, usually after about 3 months and 20 ejaculations, to confirm that no sperm are present. Until a 0 sperm count is confirmed, another form of birth control must be used. Tubal ligation is also very effective, but its failure rate is slightly higher than that of a vasectomy. The chance of pregnancy after a tubal ligation is estimated to be about 1 in 200 over a person's lifetime. Unlike a vasectomy, tubal ligation is effective immediately. However, if a pregnancy does occur after tubal ligation, there is a higher risk that it will be an ectopic pregnancy, where the fertilized egg implants outside the uterus, most commonly in a fallopian tube. This is a serious medical condition that requires immediate attention. Perhaps the most crucial comparison is the risk of complications. All surgical procedures carry some risk, but the level of risk associated with a vasectomy is considerably lower than that of tubal ligation. For a vasectomy, the risks are generally minor. They can include bleeding or a hematoma, a collection of blood inside the scrotum, infection at the incision site, or a dull ache in the testicles that may last for a short time. A rare complication is post-vasectomy pain syndrome, a chronic pain condition that affects a very small percentage of men. However, major complications are extremely rare, and the procedure is considered one of the safest surgical operations performed today. The risks associated with tubal ligation are more significant, primarily because it is an intra-abdominal surgery performed under general anesthesia. The risks of general anesthesia itself include adverse reactions to the medication and breathing problems. Surgical risks include potential damage to the bowel, bladder, or major blood vessels. There is also a higher risk of infection and bleeding compared to a vasectomy. While these major complications are not common, their potential is real and makes the procedure inherently riskier. So, we have a clear picture: a vasectomy is quicker, has a faster recovery, a slightly lower failure rate, and is significantly safer than a tubal ligation. This leads to the big question: why is tubal ligation performed about twice as often as vasectomy in many parts of the world? The reasons are complex and rooted in social, cultural, and historical factors rather than medical ones. Historically, family planning and contraception have been framed as a woman's responsibility. This societal norm has persisted for generations. Many healthcare systems and cultural conversations are more geared towards discussing contraceptive options with women. From a young age, women are the primary recipients of reproductive health education and services, so when the time comes to consider a permanent option, the focus often defaults to them. There's also a lack of awareness and education about vasectomy. Many men, and even some women, have misconceptions about the procedure. Some wrongly believe it affects sexual performance, masculinity, or testosterone levels. In reality, a vasectomy has no effect on a man's libido, ability to have an erection, or the sensation of orgasm. The only difference is that the semen will no longer contain sperm. Overcoming these myths through better education is crucial. Furthermore, access and physician counseling play a role. Some men may feel uncomfortable discussing the topic or may not be offered a vasectomy as a viable option during family planning discussions with their partners or doctors. The conversation needs to shift. When a couple decides they are done having children, the discussion about permanent contraception should involve both partners equally. A thorough comparison of both procedures, including the risks, benefits, and recovery time, should be standard practice. Given the clear medical advantages of vasectomy in terms of safety and ease, it stands to reason that it should be considered the primary option for permanent sterilization when a male partner is available and willing. Making an informed decision is key. Understanding that tubal ligation involves more risk, a longer recovery, and a more invasive procedure is essential for any couple weighing their options. Choosing a vasectomy can spare the female partner from undergoing a more complex and riskier surgery. In conclusion, when we look purely at the medical data, the comparison is stark. Vasectomy is a simpler, safer, and less invasive procedure with a quicker recovery and a lower failure rate compared to tubal ligation. The disparity in their usage rates points not to a medical reason, but to deep-seated societal norms and a lack of information. By having open, honest conversations and spreading accurate information, we can empower more people to make the choice that is truly best and safest for their family. Thank you for joining me today on Sex Education Repo. If you found this video helpful and want to learn more about sexual health, please subscribe to the channel and share this information with others. Knowledge is the first step toward making empowered choices.